So in what ways are doctors already feeling the cost of Obamacare? Dr. Martha Boone is a urologist with a private practice, a small business in Atlanta, Georgia. Now, just this week, she learned the cost of health insurance for her 5 employees has shot up 27% from $550 a month to $700 a month. Dr. Boone joins us now from Atlanta, and Fox News medical contributor Dr. Mark Siegel is here with me in New York. Dr. Boone, first to you. So you do have a small business in addition to having a personal interest in health care. How is your staff taking these increases in health costs?
Well, so far I've taken all of the brunt of it. I've paid all of their health care costs as long as I've been in business. But now with a 27% increase, I'm not really going to be able to do that anymore. So we're actually trying to figure out what we're going to do.
Are you going to have to lay somebody off?
That's one of the options. The thing I've been fighting to not do all year is to drop my Medicare patients. I'm very concerned about them. We're having access problems in Atlanta. And running a small business, I mean, I have a few options. I can have my people be uninsured. I can lay someone off. I certainly can't hire anybody. And I can consider stopping taking Medicare, which I really do not want to do. But
Dr. Siegel, a lot of doctors all over the country are beginning to do that. I've been hearing a lot of Medicare patients are refused entry now.
Well, that's actually the key point, David. It's not always an all or none. The AMA actually did a study over the summer which showed that 18% of doctors are restricting their Medicare practices. And we also have found from Medicare itself that over the past decade, expenses of taking care of Medicare patients has gone up almost 20%. And our income is not going up, and patients are living longer and longer. They're having more and more medical problems, more and more technology. Now we're faced with an independent Medicare advisory panel starting in Washington, federal oversight that's going to say this service is allowed, that service isn't allowed. It's going to be impossible to take care of.
Dr. Boone, in your notes before I started this interview, you have a heartbreaking case of this woman who's a single mom, works for you. She also takes care of her mother, and she had to think about going on Medicaid, but she actually makes too much money to go on Medicaid. So it actually, in the end, it may be better for her to quit her job so that she can go on Medicaid and help her mother. I mean, there's something perverse about that.
I certainly hope it doesn't come to that, but we're running out of options. I mean, last year we saw a 32% decrease in reimbursement on our major things that we do in our office. And these two lines are meeting each other. I mean, health care costs are going up, cost for malpractice premiums are going up, rent's going up, and reimbursement's going down. I mean, any small business owner would tell you those numbers are going to merge, and I don't know what happens when that time comes.
Dr. Boone, I mentioned that there are a number of physicians going for cash only now, getting rid of not only Medicare and Medicaid, but also private insurance patients and just doing cash only. Have you thought about that?
I've thought about it. I really love taking care of my teachers and my policemen and my Medicare patients, and I'm trying very hard not to have to go that route. But many doctors in our community are doing that, and it's making it very hard to find access for the Medicare patient when we do take care of them.
Dr. Siegel, is it unfair to equate these problems that Dr. Boone and you and other doctors are having with Obamacare, because it's only been rolled out in the past couple of months?
It's totally fair. And by the way, I have to say a nod to Dr. Boone. She's an altruistic, caring physician, doesn't want to give up who she has. I have the same issue. I'm not saying goodbye to my patients. The federal government is exploiting that because they're counting on that, and it's not going to work.
So how is it directly related to Obamacare?
Because Obamacare is rolling in an entitlement where it's too easy to overuse this insurance. Copays are going to go down. Deductibles are going to go down. Patients can flood the waiting room anytime they want. We are not there to take care of them. There's a huge doctor shortage, and we haven't been consulted in all of this. The cost of that is enormous, so the only thing that insurance companies can do is either decrease services or increase premiums. We're going to see both.
Now, Dr. Boone, I suspect, because what Dr. Siegel said is true, you can tell you're a really, it's in your blood and bones, this idea of doing what you're doing for your patients. So you'd probably do it for free. But there are a lot of doctors who are probably being turned off, potential doctors who are being turned off to the profession because they see what's going on. Have you found that to be so, where people who might otherwise be going into medical school are holding back because of all the messes here?
I've been keeping a list, and I currently know 3 wonderful kids who have dropped out of medical school because they don't think it's going to be financially feasible to be a medical student and pay for their education. I mean, my education cost $350,000, and I didn't get out until I was 32 years old. I have seen 19 physicians who've retired early before retirement age, and so far I have 27 physicians just in my little neighborhood who have stopped taking Medicare. So this is a serious problem in our community, and Atlanta is a very affluent community.
Dr. Siegel wants to chime in. I wish we had more time. We don't, but I'm sure he has numbers that are just as scary as that. Dr. Martha Boone, thank you so much for being here and for what you're doing. And you too, Dr. Siegel.